Hey guys, this video is about monkeypox. As I understand it, it was declared a global health emergency by the World Health Organization following a surge in cases. This was about 9 hours ago, 10 hours ago. Been 5 deaths so far as a result of the outbreak. So there's only 2 other health emergencies right now: coronavirus and the continuing effort to eradicate polio. I understand there was a case in New York City earlier this week or last week in reference to polio. Dr. Tedros said the emergency committee had been able to reach consensus on whether the monkeypox outbreak should be classified as a global health emergency. However, he said the outbreak had spread around the world rapidly, and he had decided it was indeed of international concern. Too little was understood about the new modes of transmission, which allowed it to spread. The WHO's assessment is the risk of monkeypox is moderately globally and in all regions, except in the European region, where we assess the risk as high. Their assessment, the risk of it is moderate globally in other regions, except for Europe. It's also a clear risk of further international spread, although the risk of interference with international traffic remain low for the moment. He said the declaration will help speed up the development of vaccines and implementation of measures to limit the spread of the virus. It's an outbreak that can be stopped with the right strategies and the right groups. Monkeypox first discovered in Africa in the mid-1950s. Declaring global emergency is a significant act. It's a rallying cry for countries to take the virus seriously. It raises awareness around the world, and it can help poorer countries get the tools it needs to control monkeypox. Principally, we have the tools to stop it. It's not spread as easily as COVID. We already have a vaccine developed for smallpox, which is in the same family, that offers good protection. Anyone can catch it. The outbreak is overwhelmingly concentrated in gay and bisexual men, as well as other men who have sex with men. This can make the outbreak easier to tackle, as efforts, including vaccines and public health information, can be targeted at those most at risk. More than 16,000 cases have now been reported from 75 countries. I just want to break down my viewpoint on it. I don't like to do these videos when I have something I think is legitimately, positive information that is worth a video. It's so sad to me that the WHO can declare a global health emergency, and it's just another day. I used to watch the documentaries, National Geographic, back in about the arts and all that, talking about, what if you had a major pandemic? What if you had, peak whale? What if you had big earthquakes? I used to watch that stuff, and they would talk about the WHO. They would talk about global health emergency. That was a big deal back then. I mean, watching that was a big deal because that was supposed to be the very best of our world coming together in common cause to solve a problem that we face. And we're in an era now that they're kind of they don't have the power they did then, and that's sad because we're going into an era we need them more now than ever. You haven't heard much about monkeypox, and the little you have heard has been nonsense. My take on it is this: for Republicans, you do nothing about monkeypox. You do nothing about COVID. You downplay it. It's gay disease. If monkeypox fades away in a month or two, if it turns out to not have as many mutations as I'm hearing it does, well, they can just say, hey, it's faggots. And God hates faggots, so they got what they deserved. Like they said with HIV, they call it a gay cancer back then, right? It's gay cancer, right? Those faggots will die. If monkeypox gets bad, and what I'm hearing about is now kids are getting monkeypox, young children, not through sex, but just through household transmission. If it gets bad and kids start dying and stuff like that, they're going to say it's pedophiles. And they're going to put, I'm telling you what's going to happen. Because I've been saying once this starts getting bad, if they have to do any restrictions, they're going to say there's going to be some homophobia stuff. But like I said, now the kids are getting it. If it gets bad, hopefully it doesn't, they're going to say we have a pedophile problem. And that this shows you the pedophile problem. What happens when all these kids go back to school and they start getting it? They're going to say teachers are fucking the kids. So you win. You win both ways. Republicans win either way here. It's actually a good tactic. It's a really cool tactic that you do nothing and you watch the world burn. Just like with COVID, do nothing and watch the world burn. It is so distressing to me to realize this and to understand that this is the future. I said the next pandemic will be handled much worse than COVID. I said that and I stand by it. And I also said before that COVID really was a sign of the times. That we're not living in an era where you live long and healthy and you have a sustainable, stable society. No, you're living in a time now where poor people, old people, you're on your own. You're on your own. And we're not going to do the bare necessity to keep the least of us safe, healthy, and well. That's what this represents. That's really, to me, COVID, just taking the science out of it, COVID, to me, represented an era. And if someone's asked me the time before March 2020 and time now, that we're in a time now where it is really like the law of Darwin, like the we call it strongest will survive or whatever. That people who just can't afford to take preparations and stuff, well, you're in an increased chance of dying. And there's plenty of people who got COVID that had money and just didn't take it seriously. But there's a whole lot of people who we know work jobs where they can't mask. They're working with the public. They're working in the public. They're doing, jobs that are dangerous, or they can't wear masks. They can't do certain things that are protective. And a lot of folks died or got long COVID. So you're living in an era now where it's like there's people who can get a PAPR, they get respirators or whatever, and they'll be okay. They can get, like Joe Rogan, got a monoclonal antibody, Z-Pack, a vitamin IV, zithromycin and all this kind of crazy stuff. He can do that because he's got money. He's got means to protect him. COVID, to me, brought out the very worst in our societies. And I worry that monkeypox is a continuation of that. Because where I'm going with it is these diseases represent a time we don't come together in common cause to deal with problems. We further balkanize. And the government is more balkanized. And so we don't make the right decisions and things get worse as a result. Here we go. Health officials have confirmed the first 2 U.S. case of monkeypox in children. So I'm talking about. CDC reported Friday. Today is Saturday. Both cases are, quote, likely the result of household transmission and had no contact with each other, the agency said in a statement. One is a toddler, lives in California. The other is an infant that was not a resident of the U.S. and was transitioning through the Washington, D.C. area when the test was done. Yeah. This monkeypox stuff is bad. This isn't just about a bunch of sores on your hands. I've heard it's actually worse. The symptoms of it are worse than COVID was. And I'm hearing people who had COVID. Can I add this too before I end the video? I'm hearing about science saying COVID infection takes 10 years off of immune system's life. So essentially a few infections and you've eliminated the lifespan of the immune system if you extrapolate that, whatever. There's people who've had it 3 or 4 times. And I just wonder if we've had people that have gotten COVID, mild cases or whatever, or, wasn't that bad. And we're thinking like, okay, well, COVID didn't kill us. And if there could be something coming or something get worse, there could be a threat to people's lives. It's something to think about because I've heard of people who have had it many, many, many times. And the science seems to kind of intimate that further infections, your immunity doesn't last very long. You can get it again in 90 days. There's something to think about here. There's something to think about that we're living in a very dangerous time. And the threat isn't just COVID. The threat is the diseases. The threat is antibiotic resistance. The threat is hubris from our politicians, from our right, and from citizens that are uninformed or are unwilling to inform themselves. Thanks for listening.